It's my feel-good breakfast show.
Welcome back. Thank you so much for tuning in once again. It's been an absolute pleasure hosting you this morning, and we're going to continue. I love that sound. I get into such a happy mood when I hear that little laugh, but it's going to be quite serious, our baby talk chat today. Colic. Oh, the terror that comes with that word can be described as frequent, prolonged and intense crying or fussiness in a healthy infant. And to chat a little bit more about some of the causes and symptoms and, most importantly, treatment of colic is Sister Doriska Postumus, a lactation consultant and registered nurse, as well as pediatrician Dr. Phillip and Sr. Guys, welcome back to both of you.
Thank you very much.
Dr. Kutsia, you've actually had a very close relationship with our team. I know that you've been of great help to Kat as well, but welcome back, guys. Can you please explain what colic is? Because if you've experienced it, certainly as a first-time parent, it's very difficult to actually pinpoint what is going on. It's just a whole lot of pain and crying and lack of sleep.
But that's exactly what it is. There's an academic definition, and there's a what is perceived and what's real, and what is normal by baby crying, because babies cry. So
yeah, I think that's it's a very good question, and it's got a very difficult answer. And I think we're also
you're a doctor. Come on.
We're also trying to figure out exactly what the answer is. But basically, it's a baby who is crying more than we would have expected the baby to cry, but the baby is healthy. Or baby's fussy, crying, but he's healthy. That's a very, very important distinction.
Mm-hmm. Yeah.
Okay, so, and we typically see a couple of things surrounding colic where we see a trend. So a baby that's typically crying a lot, very fussy and irritable in the evenings most of the time, or there's a set time. Parents can often tell you it starts at 6 o'clock at night, and then it ends again at this time. And it carries on longer than we would expect normal crying to be. And Sister Doriska will also tell you that normal crying, we can see 1 hour to 2 hours of normal crying a day in a small baby, and it's still normal.
It's normal. Babies cry. That's the only way to communicate, and it's not always to say they're in pain.
Yeah.
But when they have colic, they look like they're in pain. They look uncomfortable, and it's quite disturbing for you as a parent.
Sorry to interrupt you, but the big distinction that we also just have to always remember is that we have to make sure that the baby is healthy, that the baby is not crying because there is something wrong underlying.
There's another medical
that there's another medical condition going on.
I think for me, because I experienced this with baby Luca as well, I didn't know what the reason was. What are some of the causes of colic that...
I want to say indigestion. Is that...
But that's exactly what it is. What is colic? It's stomach pain.
Yes.
It's pain, it's discomfort, it's...
Yeah, so lots of postulations or hypotheses around what causes colic exactly, but no clear answer just yet.
Okay.
So people have been hypothesizing about whether it's a physical problem in the gut, that the gut is maybe a little bit immature and not handling the feeds very well. That's one possibility. Another possibility is that babies may be picking up on the parental anxiety, especially first-time mothers. Babies not being handled very well, and the baby picks up on that anxiety. Other postulations would be...
I hope it's not that.
But it's a possibility. Another thing that I read up and which I see is your temperament and your child's temperament. And that plays a role, and that's something interesting to investigate in.
I think one important thing to remember is if your baby has colic, just remember that your baby is not rejecting you.
Yeah, you're not failing as a parent.
You're not failing as a parent.
If anything, you're earning your stripes as a parent, and it's a big part of it. I've got to ask this, is it more prevalent and localized in the Western world?
Definitely, yes. So we see definitely that there is a very big association, colic in certain demographic areas where we see more colic versus others, and it's got to do a lot with westernized cultures, where our perception of what normal crying is or should be is a little bit, I think, not what it should be.
So we need to, in other words, what you're saying is we need to recalibrate our brains.
Lower our expectations.
Okay. I thought you were going to say Westerners are just fussy. We're fussy from birth right the way through. Okay, we're going to delve a little bit deeper. I want to know how painful, I know obviously it's difficult to relate, but how dangerous colic can be. So you can think about that. We're going to continue our discussion. If you've got any comments or questions or secret family remedies, maybe some insights to offer us, you can join the conversation on our Facebook page. We'd love to hear from you.
It's my feel-good breakfast show.
Welcome back as we delve back into our baby talk chat. We are talking about colic this morning and welcoming back Sister Doriska and Dr. Phillip. Guys, thank you so much for basically debunking the whole myth around colic. I'm beginning to think maybe it's just a Western thing that we have cooked up because we can't deal with our babies crying too much. But I know I really am oversimplifying here and taking nothing away from what parents go through when your baby just won't stop crying. It can be one of the most frustrating, unnerving experiences that you can go through. When we left our conversation, I wanted to ask, I left the thought with you, how dangerous is colic? How much damage is being done? How much pain is being felt, do you think, by the babies? And how dangerous can it be?
I think the first thing to remember is that when we talk about colic, is that we are referring to a crying in a healthy baby. That crying is not dangerous. So yes, the baby is experiencing some discomfort. We don't know to what degree, but we can see it on the baby's face and by the way the baby is responding to it. But in the long term, the colic or the colicky crying does not have any sequelae.
Yeah.
Okay, and that has been shown over and over again in clinical trials.
Okay, so if the crying is associated to a medical condition, though,
It's
that's
completely a
different.
different story.
the danger comes in.
We were just speaking about this now. There's so many old school remedies, behoedmiddels, versterkdruppels, grijphoute, all these little treatments. We don't know where they come from, but is there a treatment for colic? I call it the C word. It's like a C word.
It is. It's a C word. It's a swear word. There is a lot of remedies on the market, and you'll go to this pharmacy and that pharmacy, and they mix up whatever, and you give it, and you have no idea what's in there.
Yeah.
I mean, really?
Yeah.
Do you want to give that to your child? At the end, you want to look at keeping your child's digestive tract comfortable.
Yes.
So keeping the baby up after feedings, burping the baby well. I always say if you had a big meal and you go and lie down, you are uncomfortable. So keep that baby up for a while, like I said, burp well, and then also how you feed the child. So if you are breastfeeding, that it's laid back and relaxed, and also if you are bottle feeding, to do it slowly and you pace the feeding. It's not just look, because that child will have more weans and more cramps. So that's those things that we start looking at for me. For the first, we look at the comfort, making the baby comfortable after feeds, feeding properly, and then again, your expectations.
I mean, that leads into my next question, and possibly this all involves us adjusting our mindset when it comes to our baby crying and them being, in a state of discomfort. What are some of the biggest myths that you feel you need to debunk right now?
Okay, so myths, that's a bit of a tricky question. So I think, I don't know if you can answer this question better than I can, but for me, when I see a baby who cries a lot and where the mother brings the baby, and it's very often at the 6-week checkup or sometimes even a little bit earlier, where the mother would complain that the baby's crying a lot of the time, and where a little bit of reassurance for being seen by the healthcare provider, the doctor or the sister, and being examined and told your baby is fine, your baby is well.
Okay.
That is very important. And just to attach to what add on to what Doriska said about the management of colic. So we always try everything that is free first, and that's positioning and burping and how you feed your baby, massaging the tummy, warm bath, co-sleeping, sleeping on top of you, things like that. And then the next step would be trying to see what treatment can we do? Because there is a percentage of babies who have colic who suffer from something that we call cow's milk protein allergy. And if it's a formula-fed baby, we would consider a hydrolyzed. It's not entirely the same thing, but in that field.
Similar vein, yeah.
So we'll consider a hydrolyzed formula, or if it's a breastfed baby, we'll tell the mother to maybe follow a hypoallergenic diet where she cuts out certain foods or dairy, for example. And then we do that for a week. And if we see it doesn't make a difference, specifically with the formula, then we go back back to normal. And then in terms of medicines and the drops that you refer to, there's very little evidence, to be honest with you. The one new thing on the block, or new remedy on the block, is a probiotic, where there's a specific strain of probiotic that they call Lactobacillus reuteri that's been shown to improve coliciness, can shorten the duration of coliciness, because we know colicky babies, it resolves normally by the time they're 3 months old.
Works itself out, yeah.
And then at the end of it, by 3 months, you don't always know what worked, but it's gone.
It's
and
gone.
you can
It's
smile
just
and
like
you can
one
sleep.
day.
I think a good place to start, don't call your baby a colicky baby. I think you need to kind of adjust your own expectations around what babies need. Often babies will cry and do cry, but we do certainly empathize. I can, as a parent, certainly speak to how difficult it is and how stressful it can be if your baby just won't stop crying. But maybe start with yourself and adjusting your expectation, calming yourself down, and maybe they'll feed off that as a starting point. And don't be shy to ask a sister, ask a doctor for advice, or maybe just a little reassurance.
Yes.